Hey, Joe, how are you?
Hey, good. How are you, Greg?
I'm doing great, thanks. Thank you for jumping on with us today.
Of course, not a problem.
We wanted to thank you for being a great customer and a partner of Playback Health. In your role as Associate Executive Director at Lenox Hill, we know that you made a decision during the first COVID wave to use Playback Health. Can you tell us about why you chose our platform to deal with COVID?
Absolutely. So we made the initial decision because, communication is still key before COVID, during COVID, after COVID. And we needed a way to consistently and clearly communicate with patients and families when visitation went away. We didn't have patients and families together at the bedside. So we needed a way to do that. And we leveraged, Playback being a HIPAA compliant solution to allow us to communicate to patients and families and know, did the patient and family get the communication, right? Did they receive the update that we sent them? And Playback had features that allowed us to clearly communicate. So it was a game changer for us.
That makes sense. And what ultimately made you decide to look at technology solutions like Playback?
So we looked at a lot of technology, and we had to look at a lot of technology very quickly. And we started out as elementary as, looking at iPads and just doing simple FaceTiming to multiple other platforms that exist out there. And we landed on Playback, as I said, because it checked all the boxes. It was HIPAA compliant. It was easy to use. It was accessible on every device. And it allowed us to share things with that family member, with that healthcare proxy, and allow them to share that information, have it memorialized in the app so they didn't have to kind of forget or play the game of telephone. And we got to know when they received information and when they didn't. So that was key for us, was knowing, were we on the same page at the same time?
And what were some of the results that you saw from your usage of Playback Health?
So initially, we saw such a positive outpour of comments. As you know, there's a spot in the app for people to write and ask questions or to escalate information. And what people were writing in there was just thank you notes. They were saying thank you for the incredible work we were doing. They were saying thank you for creating this content, for keep sending more content. So we saw that as kind of phase one. And then secondarily, what we saw was when we looked at our HCAP scores from 2019 to 2020, and we looked at specifically communication with nurses and communication with doctors, we're up over 10 points in each of those domains. And that's in the year of 2020. And as we all know, 2020 has had so many different challenges. But in an environment where we are, battling a clinical diagnosis that is changing, when we don't have visitation, to have an increase in our communication scores is incredible. And so, a piece of our success has absolutely been Playback. And so we're excited to have been able to find you guys and to make this partnership.
Thanks, Joe. Anything else you'd like to share about your experience and why healthcare professionals might consider Playback?
Yeah, so I would say that we all didn't plan 2020 on battling COVID, and Playback wasn't designed to help with COVID communication. Yeah. But what Playback I think was meant to do is help with communication. So I would challenge anyone and everyone, if you have a communication challenge, if you have a gap or a barrier that you're trying to help close, I would think about Playback Health as a way to do that. We are doing that currently in our maternity space, where a lot of our new moms come in needing lots of education, pre-education, post-discharge education, and we're leveraging Playback as a communication vehicle to do so. So I would challenge everyone to think outside of the box and see what you can leverage the technology for.
Well, thanks, Joe. We certainly appreciate your partnership. We so appreciate Lenox Hill Hospital, and we're certainly so happy to have Northwell Health as a Playback partner. So thank you for taking the time. Appreciate it.
Absolutely. Thanks, Greg. It was great chatting.
All right, bud. Bye-bye.
Bye.